Natural immunity outperforms vaccine against COVID-19 US study. Researchers found that patients who had not been vaccinated but survived COVID were more protected than those who had been vaccinated and had never been infected with the coronavirus Delta variant, according to a new research published Wednesday. SARS-CoV-2 natural versus vaccine-acquired immunity, which is better? This is the latest study to weigh in on the topic, but this time it has the seal of approval from the U.S. Centers for Disease Control and Prevention, CDC. It's important to keep in mind, however, that unvaccinated individuals who haven't previously been sick are at a greater risk of hospitalization, long-term effects, and death than vaccinated people, according to the authors of the study. Some 131,000 people in California and New York died from COVID-19 by November 30, 2021, which is when the paper that used statistical modeling based on the two states was written. A pre-Omicron variant study was also conducted out before vaccination and infection-derived immunity seemed to be decreased for the Omicron variant and before boosters were widely marketed. As of November 30, 2021, New York and California had 1.1 million persons who tested positive for HIV between May 30 and November 30 of that year. Vaccination provided stronger immunity than infection before Delta became popular. In late June and early July, though, the connection changed. Persons who had not previously had a COVID vaccine were 3 to 4 times as likely, in California and New York, respectively, as unvaccinated people to get ill by the week of October 3 as those who had received a prior COVID vaccine. There was a threefold increase in the hospitalization rate of patients who had not previously received the COVID vaccine in California during the weeks of October 13 and November 14 of this year. Those who had both been vaccinated and had previously had COVID had the best protection. Because the research omitted patients who died and who were disproportionately unvaccinated, it is possible that the results would be skewed due to a phenomenon called selection bias. During the Delta surge, natural immunity was shown to be more effective than vaccinations in several studies, including a noteworthy article from Israel published in August. A different view had been adopted by the U.S. Centers for Disease Control and Prevention, CDC, prior to the Delta study, however.